Hello and welcome. My name is Jim Rutledge, and I want to be your candidate, your choice to represent you in the United States Senate here in Maryland in 2010. I am a constitutional conservative. I'm a Ronald Reagan Republican. And in this segment, I want to talk about health care in America, or rather, the attempt of our government, our federal government, to take over our health care system completely from stem to stern in America. As a United States Senator, I will vote against any government takeover, any federal government takeover of our health care insurance system, our health care delivery system, and the intrusion of a government bureaucrat into that most personal decision between a physician and their patient. I believe in healthcare freedom. I believe in the human dignity to give you, the citizen, a certain amount of choices with regard to your health care. And I am asking you to join me and participate in making decisions about what health care to buy and how to pay for it. So let's get right into the nuts and bolts here real quick. I am an advocate for improvement in the dynamics of our healthcare market. I'm sure you would agree with me that by and large the quality of healthcare in Maryland is superior, head and shoulders above healthcare provided even in other parts of the United States, and American healthcare quality is a very high quality healthcare system compared to that of other places in the world. Our neighbors to the north in Canada, they have a big government health care program, but their members of parliament, when they get sick, the first thing they do, if they have cancer, book a flight or a train to the United States of America to get into one of our hospitals to be treated. That ought to tell us something as Americans about the high quality of health care we have available to us. We do have problems in dealing with the cost of healthcare, in dealing with healthcare access and healthcare insurance access in America, and we're not going to ignore those problems. But I'm an advocate for healthcare freedom. More choice in healthcare is what we need, not less. As the government intrudes itself and takes over our healthcare options and insurance industry more and more, which is what is proposed by Senator Mikulski and the other hard left Democrats in the U.S. Senate. As that happens, the choices for us as consumers, the choices for us as patients will go down. We need to increase the options and the choices for people to buy insurance to provide for their health care. For example, the employee should be able to take their health insurance policy wherever they go. One should not be shackled to their current job because they're afraid if they switch jobs, they're going to be knocked off the insurance policy. They're going to now have a pre-existing condition exclusion and have no option to change jobs. How many of us, how many of you out there today have wished you could change your job, but you needed to stay because of your health care insurance policy? Portability, giving the patient the ability to buy the policy, to select the policy is very important. How about this idea? Let's give you, the consumer, a choice of the type of insurance coverage you would like to have on your healthcare policy. For example, do you really want your healthcare policy to cover every single type of healthcare treatment available under the sun? You may. That may be a very expensive policy. Or you, like many of my friends and neighbors, are satisfied with a catastrophic policy. Especially younger folks are happy to take a risk with their health care insurance a little bit, but if they get really sick or in a bad accident, that you know you're not going to be bankrupted by the hospital bill because you have a catastrophic policy. It's so important for the consumer to be involved in those type of choices. And to do that, we need to broaden the market on what type of private health care insurance would be available and the number of insurers who are able to engage in that process. These are free market solutions to our healthcare problems. Portability, more choice, and with regard to choice, it's so important that the patient be able to consult with their physician about what treatment you're going to receive. And doctors are under so much pressure to order so many unnecessary tests because they're afraid of being sued. When a doctor messes up and it's just a mistake, but it's not negligence, they still get sued. In addition to complying with regulations, a hospital can comply with every regulation under the sun and still get sued. Tort reform has to be on the table, has to be discussed in Annapolis, in Washington, D.C. These are very important issues, and they do impact the Constitution very much because we have valued the right to the jury trial as a fundamental right. It's laid out in the Declaration of Independence. So when we talk about the types of laws that will govern liability in the medical system, we need a representative in the U.S. Senate who understands the complexities of the tort system and the litigation system so we can reach meaningful results that will really result in lower costs and more choice. That, my fellow Marylanders, is a pathway to improvement of our healthcare system, not a government takeover of 1/6 of our economy. Thank you very much.